Now, the stories of frustration that have turned into freedom from pain continue to grow at Total Health Chiropractic. On our most recent visit, we heard from yet another patient who found relief using the DRX 9000 program. Take a look. When it comes to chronic neck and back pain, people who suffer from that never want to hear, well, you got to live with it, or try this or this, or they want answers, and that's what they get here at Total Health Chiropractic. Dr. Miller, and we have Deb with us this morning as well to share her story about how they got those answers. Do you hear that, Dr. Miller, that people come in here saying, my doctor's just not telling me any answers?
And it's a shock to me, Todd. I would think people would want to know what the problem is and know what options they have to fix it. But, you know, many of these patients have dealt with these problems for months and years, tried all these treatments. Some even had back surgery, and they still didn't really know what the problem was. So that's something that's very important to us, is that, you know, we want to educate our patients so that they fully understand what the problem is. So when we talk about solutions, they understand why that would work for them.
Yeah, it seems pretty basic, but as you said, you'd be surprised how little that happens. Deb, let's talk about what was going on last fall. Let's take you back to an October morning of last year. What was life like?
Yeah, it seemed like, I mean, although I've had this ever since I gave birth to my son, I've had back pain, but it was something that I could manage on my own. But this kind of came on suddenly, like all of a sudden it was so intense, it just took over everything. So it was like I couldn't think straight, I couldn't function, I didn't know what to do. So I went to the doctor. They gave me a couple, 2 or 3 prescriptions. For about 2 or 3 months, was like out of it.
That's got to be
where I couldn't
frustrating.
function. I was like zero functioning pretty much.
And Dr.
between the physical pain and, you know, being out of it from the medicine.
We've talked about this before, doctor, how some of these treatments are Band-Aids. They're just kind of covering up the symptoms and not curing the symptoms, right?
Oh, absolutely. You know, as Deb mentioned, there's a lot of different medications. They have pain medications, muscle relaxants, there's anti-inflammatories, drugs that deal with the nerves. And yeah, they're treating a symptom, and that's why patients struggling with back or neck pain get so frustrated, is that most options out there that are recommended treat the symptom and are a Band-Aid, and that's why the problem persists and why they must keep doing the treatments over and over again. And that is something that we pride ourselves in here, Todd, is that our approach is to not only confirm what the actual problem is, but when we talk about solutions, it's an actual solution to fix the problem, not just a temporary Band-Aid like we mentioned earlier.
Deb, what did you find yourself not able to do? I mean, physically, did this limit you?
Completely. I couldn't, I live in a house that has 2 staircases, and like I couldn't carry laundry up and downstairs. Every time I had to go up and downstairs, you know, the pain would be so intense, and it was very difficult to do.
You also mentioned something about your Headspace. I mean, a lot of people know about the physical pain that they're feeling, but psychologically, what was it doing?
Well, after a while, you know, the pain medicine didn't change anything. And then I started waking up in the middle of the night with this searing, unbelievable pain that would shoot down my leg, and I had to get up out of bed, and I would like pace back and forth, and I was crying, and it was just horrible. And when that started, I just started feeling like, I don't know if I can do this. You know, I mean, I have a very high pain tolerance, but this was just beyond my ability to cope with it. So it started breaking me down emotionally and mentally, for sure.
Yeah, I can feel that you can sense that how it was affecting you emotionally, and that is something that a lot of people don't consider or think about when this happens to them, doctor.
You know, and Todd, what we find is that it is challenging for patients to deal with, because we don't see what's going on inside other people's body, so we can't tell they're having these big back problems. We just see that they act like they're in pain, and so it's very difficult to relate to these patients. You don't see what's going on. All you see is they hurt, and you know, at some point you start wondering, do they really have a problem, or are they just being sensitive? And I think a lot of doctors think that way as well, where they try these medications or these treatments, and when patients aren't responding, they don't have a whole lot left for them. And sometimes patients start wondering, is this in my head? Am I imagining this, or do I actually have a problem? And it's just a very confusing place for their minds to be in. But when we can clarify that, and again, actually show them the images and point out exactly what their problem is, why it's causing these issues in their life, it's just like a light bulb goes off in their head, and they're like, they're not happy to see the problem, but it does make them feel better that they're not going crazy. There is an actual problem going on. And then to talk about solutions, it's a very uplifting moment for many of them.
What brought you in here, and then what happened?
And one morning on Fox 17, I saw the segment, and I'm like, and I've seen it, lots and lots of times before. But I said, I'm doing that. So we made an appointment, came in to have him explain what was wrong and show me. I mean, it was just, I think I had tears when he told me that, and that there was something they could do.
Doctor, explain exactly what that treatment was, what the DRX 9000 does.
We do the thorough examination. We got her MRI. We did take X-rays, and that physician had access to her MRI as well. And I showed her, you have degenerative disc disease, drying and thinning down. She has several bulging or herniated discs. That's why she had the pain. She was not imagining this. So through all that evaluation, we made a decision to be a great candidate for our DRX therapy. And this is a non-invasive medical device to regenerate these discs. And so, as Deb's gone through the program, we're able to make these discs healthier in her back to alleviate the pressure on the nerves. That's why she's not having the pain and able to do those activities once again that she struggled with so much.
Doctor, I know that you guys want to offer a great special to those watching right now, kind of a cautionary tale. You don't wait and get to that end of the rope status like Deb may have been. Call now.
So Todd, we don't want them to wait to the end, but also just to encourage them not to give up hope, because even if they've been told nothing can be done, we do offer some pretty creative solutions for patients here, and a great special. If they want to see what we can do to help them, for $55, we do the consultation and the examination, and the first 5 callers will throw in a free hydrotherapy massage so they can rejuvenate and start feeling better right away. I did want the viewers to know we also accept flex accounts and health savings accounts to pay for treatments if they need.
Okay. FSA and HSA, all of those are accepted here at Total Health Chiropractic. Deb, thank you for sharing your story. Appreciate it, and we're so glad that you're feeling better.
Thank you.
Absolutely. Don't wait. Call now. Get a hold of Total Health Chiropractic and end that chronic neck and back pain.